All right, let's dive in. Today, we're going to be medical detectives, cracking open the fascinating field of rheumatology. This is where doctors solve the ultimate mystery. What happens when the body's own defense force goes rogue and declares a civil war on itself? So, let's start with the central question, the big one. What actually happens when the very system designed to protect you, your immune system, gets confused and starts attacking your own healthy tissues? It's basically a case of friendly fire happening on a massive microscopic scale. So to really get started on this investigation, we need to survey the crime scene. We need to understand what's actually going on when the body turns on itself. And the prime suspect, the core concept behind this whole mystery, is something called autoimmunity. You see, your immune system is usually brilliant. It's a master of telling self from non-self. It knows what belongs and what's an invader. But in an autoimmune disease, that whole recognition system just breaks down. It tragically misidentifies your own cells as the enemy and launches an attack. This chart really lays it out perfectly. On the left, that's a healthy immune system, doing its job, targeting viruses and bacteria to keep you safe. But on the right, that's the autoimmune response. The target isn't some foreign invader. The target is you. And the outcome isn't protection, it's chronic inflammation and damage. The entire case really boils down to this one critical failure of identification. Okay, so every good detective needs evidence, right? In rheumatology, the clues are everywhere. In your blood, in your joints, and even in the story you tell your doctor. So let's look at how rheumatologists gather these clues and what they reveal. The very first pieces of evidence our medical detectives hunt for are called autoantibodies. Now, you can think of these as the fingerprints left behind at the scene of the crime. They're these specific proteins that the confused immune system creates to target its own cells. Finding them is a dead giveaway that something is seriously wrong. And this is where the detective work gets really specific. A test for ANA, for example, is like a general alert, a good starting point that tells you something autoimmune might be going on. But then, the investigators drill down. If they find antibodies like anti-dsDNA, their investigation immediately zooms in on lupus. If they find rheumatoid factor, well, rheumatoid arthritis becomes the prime suspect. Now, you don't need to memorize all these names. The key thing to get is that each antibody is a vital clue that points to a different culprit. But the investigation isn't just about blood work. Sometimes you've got to go directly to the source of the problem. By taking a tiny sample of fluid from a swollen joint, doctors can get their hands on some critical physical evidence. And this table tells us exactly what they're looking for. See, normal joint fluid is clear and has hardly any white blood cells. But if you have inflammatory arthritis, that white blood cell count just jumps way, way up. And if it's septic, meaning there's a nasty infection in there, the count becomes absolutely astronomical. The fluid itself tells a story about the kind of battle that's being fought inside that joint. All right, now that we know how to look for clues, let's open up a few case files on some of the most common conditions a rheumatologist investigates. We'll see how all the evidence starts to come together to point to a diagnosis. Okay, first up on the docket, a case involving two very common culprits that cause joint pain, but for totally different reasons. We've got rheumatoid arthritis, our autoimmune suspect, and then we have osteoarthritis, which is more of a mechanical wear and tear situation. And right here, you can see how different their MO is. With rheumatoid arthritis, the pain is inflammatory. It actually tends to get a little better with activity. But with osteoarthritis, it's mechanical, so rest is what makes it feel better. RA is that internal civil war, while OA is more like parts just wearing out over time. And look at the joints they target. RA loves symmetry, hitting the same joints on both sides of the body, while OA is often more random and asymmetrical. Now, if we dig deeper into the RA case file, we find even more specific fingerprints. There's often a genetic clue, a link to a marker called HLA-DR4. Then you've got the X-ray evidence. You can literally see the space between the joints shrinking symmetrically, and you see clear signs of the attack, like bone loss and erosions. Put it all together, and it builds an open and shut case for an autoimmune attack. All right, our next case file is on a condition called lupus. Now, this one is often called the great imitator, and for good reason. Its symptoms are so varied, they can mimic dozens of other illnesses, which makes it a really, really tough case to crack. So how in the world do you unmask an imitator? Well, you have to look for highly specific, almost weird clues. We already saw that those specific antibodies are a huge red flag. But lupus also leaves other strange evidence. For instance, some of its antibodies can accidentally trigger a false positive on a test for syphilis, or they can cause a very particular kind of blood clotting issue. These are the unique little anomalies that help detectives see right through the disguise. For our final case file, we're looking at a group of diseases called vasculitis. Now, in these cases, the immune system isn't going after the joints or the skin, it's attacking the blood vessels themselves. This creates inflammation that can mess with blood flow pretty much anywhere in the body. And this is just a fantastic example of pure clinical detective work. The patient's profile is a huge clue. If your patient is over 50 and they tell you their jaw hurts when they chew, your investigation immediately zeroes in on giant cell arteritis. But if they're under 40 and you find a big blood pressure difference between their arms, that points you straight toward Takayasu arteritis. The details, they matter so much. Okay, so cracking the case is one thing, but that's only half the battle. Once you've identified the culprit, you need a plan of action. So let's take a look at the modern arsenal of treatments used to fight back and bring peace back to the body. The strategy for fighting back isn't about finding one single magic bullet. It's about building a personalized arsenal, using a smart combination of therapies to get symptoms under control, dial down the inflammation, and prevent long-term damage. The approach has to be just as sophisticated as the disease itself. Let's use gout as a perfect example of this strategy. It's a two-step approach that works for a lot of these conditions. Step 1 is all about reaction. You tame that immediate awful flare-up with powerful anti-inflammatories. But then comes step 2, which is proactive. You use long-term medications to stop those attacks from ever happening again. It's about both putting out the current fire and fireproofing the building for the future. And when it comes to being proactive, nothing has been a bigger game changer than a class of drugs called biologicals, especially for conditions like rheumatoid arthritis. These aren't blunt instruments. Think of them more like precision-guided weapons. I mean, just look at this list. It shows you the incredible level of precision we have now. Instead of the old sledgehammer approach of just suppressing the entire immune system, these drugs go after very specific molecules or cells that are actually driving the inflammation. Whether they're blocking a chemical signal like TNF-alpha or taking out certain problem-causing cells, each one is a targeted strike designed to disarm the autoimmune attack with as little collateral damage as possible. And in the end, rheumatology really is what this quote says. It's the art of deciphering the body's internal conflicts. It's all about meticulously gathering clues, trying to understand the motives of a misguided immune system, and then using this incredible, ever-advancing arsenal to restore a very delicate peace. You know, as this medical detective work gets more and more refined, the mysteries that seem totally unsolvable today, they could become the routine cases of tomorrow. And that just makes you wonder, what unsolvable autoimmune case is going to be cracked next? Thanks for tuning in.